right now. A tiny gland in your neck is controlling everything in your body. Remove it, and your body starts shutting down. Your heart slows. Your brain fogs. And without treatment, it can kill you, not from an accident, not from cancer, just from losing one small gland. This gland is your thyroid, shaped like a butterfly, smaller than your fist. It controls your heartbeat, your weight, your energy, your mood, your thinking. Think of it as your body has a speed dial. The thyroid is that dial. Remove it, and the body has no idea how fast or slow to run anything. Over 200 million people worldwide already have thyroid disease. Most do not know. In this video, we remove it and show you what happens second by second. The thyroid sits at the front of your neck, wrapped around your windpipe, about the size of a walnut. It has two lobes connected by a thin strip of tissue, which is why it looks exactly like a butterfly. Inside, millions of tiny circular follicles, each one filled with thick amber liquid called colloid. That colloid contains the raw material for thyroid hormone. The thyroid uses iodine from food to make it. The thyroid makes two hormones, T3 and T4. Think of them as the body's accelerator pedal. More T3 and T4. Everything speeds up. Less, everything slows. Heart, gut, brain, muscles, all of it. The pituitary gland in the brain monitors T3 and T4 constantly. It tells the thyroid when to make more or less. This back and forth between pituitary and thyroid is called a feedback loop. It keeps body speed perfectly balanced.
Why is thyroid disease so often missed by doctors for years?
Because the symptoms are vague, fatigue, weight gain, mood changes. They look like many other conditions. Without a blood test, it's hard to diagnose. Now the thyroid is removed. The operation is called a thyroidectomy. It can be total or partial. From the moment it is removed, T3 and T4 levels begin to fall. The body has no more accelerator pedal. In the first days, the patient may feel relatively normal. The existing hormones in the blood take time to clear, but within 1 to 2 weeks, the effects begin. The metabolism slows. Every process starts running on low power. Heart rate drops. The heart beats slower and weaker. The person feels deeply tired from the simplest tasks. Body temperature regulation fails. The person feels cold all the time, even in a warm room. Every room feels cold. Weight begins to rise, not from eating more, but because the body is burning far less energy than before.
Does thyroid removal cause weight gain immediately?
No, not right away. Hormones stay in the blood at first. After a few weeks, metabolism slows. With the right medication, weight stays stable. Brain fog sets in. Thinking becomes slow and heavy. Words that normally come easily take effort. Memory suffers. Skin becomes dry and thickened. Hair begins to fall out. The face can become puffy, especially around the eyes. Constipation develops. The gut runs on thyroid hormone too. Without it, everything slows, including digestion. In men specifically, testosterone levels may drop. Energy, libido, and muscle strength all decline. If completely untreated for a long time, Myxoedemacoma. The body slows so far that consciousness is lost. Fatal without treatment. But here's the truth about life without a thyroid. Most people live completely normally, with the right medication taken every day. The thyroid job is replaced almost perfectly by a single tablet. People without a thyroid work, exercise, have children, travel, compete in sport. The organ is gone. Life is not. The adjustment period matters. Finding the right dose takes weeks or months. But once stable, most people feel the same. Women without a thyroid can have completely normal pregnancies. But medication dose often needs adjusting during pregnancy. Men without a thyroid who are correctly medicated show no difference in testosterone, energy, or physical performance. The biggest challenge, getting the dose exactly right. Too much, heart races, anxiety rises. Too little, fatigue and fog return. This is why regular blood tests are essential. The body changes. The dose must change with it. Monitoring never stops.
Can you live a completely normal life without a thyroid?
Yes, absolutely. With a daily pill and regular blood tests, most people live completely normal lives. Work, exercise, everything. The medication that replaces the thyroid is called levothyroxine. It is the most commonly prescribed drug in the world. Levothyroxine is a synthetic version of T4, the main hormone the thyroid makes. The body converts it to T3 as needed. It is taken once a day, first thing in the morning, on an empty stomach, 30 minutes before food or other medications. This timing matters. Calcium, iron, coffee, and certain foods all block the absorption of levothyroxine. Take it alone. The dose is measured in micrograms, usually between 25 and 200 micrograms. It is different for every person. TSH is a blood test used to monitor the dose. Target TSH for most adults, 0.4 to 4.0 μ/L. Your doctor sets your individual target. Prevention, for people whose thyroid is damaged but not yet removed, starts with early detection. Iodine is essential for making thyroid hormone. Severe iodine deficiency causes goitre, an enlarged thyroid, and hypothyroidism. Most people in developed countries get enough iodine from dairy, fish, and eggs. Iodized salt, also helpful for deficiency, is a risk. Goitrogenic foods, raw cabbage, broccoli, kale, soy in very large amounts, can interfere with thyroid function. Cooking reduces this. If you have a family history of thyroid disease, autoimmune thyroid conditions are strongly genetic, ask for a TSH blood test once a year. Neck swelling, rapid heart rate, unexplained fatigue, always cold, sudden weight changes. Any of these warrant a thyroid blood test. Do not wait. 3 things about the thyroid that most people never know. First, the thyroid affects your mood as directly as your brain does. Low T3 causes depression. High T3 causes anxiety. Many people treated for mental health have undiagnosed thyroid disease. Up to 15% of patients diagnosed with depression have an undetected thyroid condition causing or worsening it. Second, you can feel a change in thyroid hormone levels within days. A missed dose of levothyroxine is often noticeable by day 2 or 3. Third, thyroid cancer is one of the most survivable cancers in the world. When caught early, the 10-year survival rate exceeds 98%. Most thyroid cancers are removed surgically, a thyroidectomy, followed by levothyroxine. Most people are fully cured. Your thyroid is working right now, controlling every speed, every rate, every rhythm in your body without being asked. If this video changed how you understand your own body, please subscribe. Every day we remove one more part. Leave a comment. Have you or someone you know had a thyroid problem? Tell us below. See you next day.